and this is our Lifescan Medical Center. I'll show you around.
Hi, good morning, Dr. Chua. Thank you so much for arranging time to show us around your screening center. Can you tell us more about what you do in your center?
Okay, so over here, we provide mainly health screening. Here at Lifescan, at this center, we have both the health screening arm and also the imaging arm. So we sort of combine the two services, and because this is blood tests and imaging are the basic bread and butter of health screening, so we do them both at the same place. Here we provide services like mainly health screening. We have all the executive screening packages, we have men's screening, women's health screening. We also do all this student and executive corporate screening for the patients. With it, we have the blood tests, we have the x-rays, ultrasounds of the different systems in the body, different organs. We also have CT scan and MRI, which are the higher end modalities for health screening.
Okay. So is it important to do a health checkup regularly?
Actually, a lot of people don't realize the importance. Health screening is both for early detection and also for prevention. So actually, it is very important. You do not want to wait until you are very, very ill, and then you come to a stage where it's irreversible, and then you go for treatment. And a lot of patients at that point in time, they start regretting why they did not do health screening earlier on. So health screening, like I mentioned just now, it's for early detection. There's one part, and there's also another part for prevention. So ideal scenario is we want to prevent the disease by doing the blood test. We find out from the blood test certain patients are lacking in A, B, or C, lacking in exercise, or they need to improve in their diet. They're not taking enough iron, not taking enough vitamins, or things like that. So then from there we can actually prevent other disease from coming on.
Okay.
And then the second part is the early detection. So there are a lot of blood tests. Technically, there are many diseases around, but there are some that are the common ones that we can actually prevent. There are some cancers or some diseases we can't really prevent, can't really early detect at this point in time. But the ones that we can, we should certainly work on it. So we are providing the health service hopefully to help patients in that aspect.
Let's say for someone around my age, about 30 plus, how frequent do we need to do health checkups?
Okay, so health checkup in general, if you ask me, I will put them into before 40 and after 40.
Okay.
So before 40, like your age 30 plus, I would say every 1 to 2 years is sufficient. If you're above 40, definitely at least once a year.
Once a year.
Once a year. And also then it depends on the medical background. So for example, if you are 30 but you have diabetes, you have cholesterol, you have high blood pressure, then we are talking about more frequent and more regular screening. But if you're very well, you're exercising, and your past blood test has been normal, then you can do it every 2 to 3 years. So it's very, to be honest, if you ask me, there is no one size fits all. That's why over here, all our patients, we actually see the doctor first, and then we will discuss what are the must-have, what are the good to have, and then the patient will then decide what are the tests they need to do. Yeah. So like I mentioned just now, there is that broad group, what the patient should do. There is a must-have list. So things like must-have, things like cholesterol checks, sugar checks, blood pressure, and also the must-have. So for example, for ladies above 40, they need to have mammogram. For ladies who are sexually active, they should have a pap smear. And then for say patients
even for the males as well, huh?
Yes, actually.
The prostate thing.
And the prostate and all these. So it's very, there are the must-haves, like I say, and then there are the good-to-haves, like all the ultrasounds and things like that.
But now, what's your opinion? Because there's a lot of people are facing a heart attack, sudden heart attack.
Yes.
Right.
So,
even though they are active during sports and stuff like that. So what
so I have a lot of patients who tell me, this friend suddenly just collapsed. The truth is, some case heart attack is a very highly preventable disease.
Highly preventable.
Yeah, actually. So a lot of this, what we talked about just now, the must-have must-have tests, cholesterol, blood pressure, diabetes. These are basically these are the basic conditions that actually increases your risk of heart attack.
Yeah.
Alright? So if you can actually work on these, then you check your blood test, and then if it shows that you have it high, then you control it, you sort of prevent the heart attack, stroke from coming on. Yeah, so a lot of my patients, they do the blood test, but if they don't do anything about it, I always tell them doing the blood test doesn't prevent the heart disease. You have to act on it, and then you recheck every year, and then make sure the levels come down nicely. Then in that way, the health screening helps in preventing the heart disease. Yeah.
We understand that you have also seeing a lot of international patients that to your centers. Can you tell us what's the different? Can they do examinations at their respective country, then come to seek medical treatment in Singapore, or do you advise them to come through Lifescan to do a proper regular checkup analysis?
Of course, I mean, if you ask me, technically, health screening can be done in every country, but it also depends on the facility, the blood labs and things like that. So a lot of my patients from Indonesia, from Vietnam, the feedback I hear from them is that they feel that our labs here are more trustworthy.
Yeah.
The results are more accurate and consistent. And then also to be honest, our imaging modalities, the scans, the CT scans, the images are clearer. They are better pick up, put it this way. So certainly we would advise them to come through us, okay, and then we can do the necessary for them.
So it's easier for them, for the Singapore doctor to assess through through the imaging as well, right?
Yes, correct. So we have the full spectrum.
Okay. During this COVID season, there are so many people are moving here and there, right? Do you do test for a PCR test for the patient?
Here we don't. Yeah.
You don't.
In Singapore, there's only very specific clinics that provide this COVID testing. Yeah. So based on the regulations.
I see. Okay. Can you tell us more about your imaging centers? What machine you use?
Yeah. So here we have basically both the X-ray part. So we have the chest X-rays. We have the mammograms, so mammogram is one of the must-haves I just mentioned for the ladies above 40. And then we also have the bone density test. That's also a must-have for people above 50 years old.
Above
it's
50,
actually good because we pick up things like osteoporosis, osteopenia. So those are the more pertinent X-ray parts. And then there is the ultrasound, where we can check from the thyroid, the abdomen, liver, kidney, prostate. So ultrasound is a very good screening tool because it has no radiation, so it's safe for pregnancy, it's safe in children, and it's of course not as detailed as a CT scan, but this one is good for us to pick up first. If we pick them up, then we will advise patients to go for the second step, like a CT scan or something where it's more detailed and more accurate, but of course that has a bit of radiation and all this, so we don't usually recommend CT scan as the first line. Okay, then we also have the MRI, which is more expensive but also safe, meaning that there's no radiation involved. So that is also another very good screening tool. But of course, that one is good but also expensive. So to be honest, most of our patients here, they go for the ultrasounds first. Unless some of our patients here we highly suspect something, then we push them directly for the higher end ones. Otherwise, we will do the scans, and then from there, if there's an abnormality, then we will move on.
Okay, I see. Sounds interesting about all the sharing that you share with us.